Hello, I'm Neil James. Welcome to edition 3 of Fact Not Fear. We begin with some facts. We're now entering month 5 of the coronavirus pandemic. According to Worldometers, an independent data gathering organisation, as of this writing, since their tally began on Jan 14th, there have been over 3.4 million cases worldwide. This includes over 2 million active cases, 1 million plus who've recovered or were discharged, and 240,000 deaths attributable to the virus as of recording. Of the 210 countries and territories included in the survey, the United States has the dubious distinction of leading with over 1 million total cases, including nearly 66,000 deaths, followed by Spain, Italy, the UK, France and Germany. With overall numbers still rising, there are over 75,000 people worldwide falling ill daily. We begin today with George Strait, who was the medical correspondent at ABC News for 16 years between 1983 and 1999, and did groundbreaking reporting on the AIDS pandemic, which makes his work for us on the coronavirus all the more valuable. Here's his report.
Unfortunately, the longer this pandemic goes, the more real it gets on a very personal level. Just a couple of days ago, my wife and I went to our first virtual funeral. It was for a dear friend of ours who had died just 5 days after going to a birthday party for her grandson. Seems as though that there was somebody else at the party who was also infected, didn't know it, and passed the virus on to at least 10 people. Not only our friend who died, but also several other people who ended up in the hospital. In a couple of days, it'll be 1 month that my wife and I have been sheltered in place. We live in San Leandro, California, a suburb of Oakland, just across the bay from San Francisco. Ours was among the first communities in the country to lock down, and it looks like it's worked. While the numbers of deaths here are still tragic, the intensity of the disease in Northern California, in fact, throughout the entire state, seems to be a lot less than in other states and in other cities. So what do we do to cope with COVID-19? Well, we do what a lot of people do. We focus on what's important.
Easter.
Of course, we FaceTime with our kids and grandkids about 4 times a week. They live close by, but of course we can't visit. My wife Lisa is the magician on a sewing machine, so she's making face masks for our family and many of our friends too. And I'm trying to get reacquainted with a 6-string friend long neglected. On Easter, we virtually went to church. Our priest had an interesting idea. He had all of the parishioners send in pictures of themselves. Then he put those pictures on pews where we usually sit. And I try to fight the non-activity bulge. I ride my bike about 50 miles a week. Now, I know when you go outside, you're supposed to wear a mask. And I usually do. But on these rides, there's hardly anybody on the bike path anymore. And besides, if I encounter somebody, I'm going 10 to 20 miles an hour. So I just zip right on by. The highlight of our week has been the trip to the grocery store. We've got a system. I wipe down the cart and push it, and Lisa handles the food. I don't touch it. You know, when you go in a grocery store, you get a new appreciation for what is an essential worker. It's measured by what people do for others, like grocery clerks, instead of how much money people make or their title. Most of these folks get little more than minimum wage, so we really do appreciate them. All around the store, there are reminders about physical distancing, and they're just about everywhere. Most wear masks. I found that Californians are a pretty compliant lot. I was ABC News' chief medical correspondent for about 15 years. I've got to tell you that watching the coverage of this pandemic is sort of like watching a continuous loop of Groundhog Day, in 2 ways. First, the apparent shock that so many people have that African Americans have been disproportionately affected by this disease. We did that story in the mid-'80s, and unfortunately, little was done. My fear is that after this pandemic passes, again, little will be done. Second is Tony Fauci. He's the new truth-telling hero here in the United States. I first met Tony in 1984 during the HIV epidemic. He was the NIH's chief expert on HIV, and in fact, I was the first journalist to interview him and put him on television. But Tony helped us do something that was very, very important during those days. We were having a difficult time trying to explain to our audiences just how HIV is passed from one person to another. We were stuck using euphemisms like close personal contact because we weren't allowed to use the graphic language needed to actually explain how HIV was passed on. So I got Tony to do it. He got us past the euphemisms, got us to the right language, helped us tell the truth. You know, when this pandemic passes, and indeed it will, if there is a new normal, I hope that that new normal is based on more truth-telling. With the epidemic peaking in the United States, there are calls to reopen businesses and schools. But with no testing protocol in place to determine just who does and does not have the virus, it's difficult to imagine people rushing back into restaurants or sending their kids back into crowded classrooms. I'm George Strait in San Leandro, California.
Watchers of our previous broadcasts have met John Donvan and his wife, Dr. Ranit Mashori. As an active medical professional, she's on the front lines of the battle to contain and eventually cure COVID-19. We asked John to get her perspective on the fight for you, so they sat down recently for a debriefing.
Folks, my wife, the doctor. Ranit, one thing I noticed when you were doing the questions from viewers is that there were a lot of answers where you said, I don't know. And it's not a typical thing to see experts on television saying, I don't know. So what does that tell us?
I mean, I think one of the issues is we're really learning things every day, learning new things, basically even by the hour. This is a completely new virus, which is why it's called the novel coronavirus. And we're getting information from when and where the hotspots are. That changes, as we know, every single day. So when, a month ago we learned from China, then we learned from Italy. Now we're learning from Washington State, and we're just starting to learn from the experience in New York City. So it's a moving target because it's a new virus, and this is the first time humankind is experiencing something.
And what's an example of something that it's doing that's not expected or unpredictable or unseen before? When you say it's new.
Everything.
Yeah.
Everything we know about how to handle viral infections is proving to be old news, from the damage that it does to the lungs and the heart and the kidneys, to how quickly and intensively it spreads, to what types of treatments are needed or can be used. For example, even the use of ventilators. Up until 2, 3, 4 weeks ago, that was sort of the end all and be all. Now we're learning that so many people are dying on the ventilators that people are rethinking whether putting somebody on a ventilator is even necessary, and trying to avoid ventilating somebody for as long as possible. Whereas in the past, when somebody just showed beginning signs of lung failure, the prevailing thought was intubate as early as possible. Now we're changing our practice.
So, and in terms of like what regular folks were worried about, like they probably weren't asking about intubation, that kind of thing, but like what specific questions were they like dying for answers for that you had to say, we don't know yet?
I mean, I think a lot of the questions were about when are we going to be able to reopen and go out and not wear a mask anymore, and is it going to be this summer or is it going to be in the fall? We don't know. The reason we don't know is because we're still having pockets of infection. We're getting some reports about reinfection of people who had been infected before.
Wow.
There's no vaccine, and so that was one of the answers to when is everything going to be reopened safely. We don't know.
And they're also asking things like, if I go to the grocery store, should I wash my clothes when I come home? Things like that. Is that a reasonable question?
I mean, I think...
Or is that crazy fear?
No, I mean, all of our interventions are not evidence-based because we have never had anything like that. So even when governors and mayors issued recommendations to wear a mask in public, the reality is they were basing that on what they were hoping would be the case, but we don't have the science just yet to say, yes, this is definitely helping save lives. We don't know, but we can make educated guess based on past experience.
And with all of the scientists out there who are focused on this, it must be a massive number. using the techniques that we have and the method that we have called the scientific method, should we expect that ultimately this great unanswerable set of questions will be answered? Ultimately, do we get the answers, or is this so different that we may never understand it? What do you think?
I think we ultimately will get it, but we need to be patient. And people are making decisions, clinical decisions, public health decisions, policy decisions based on very, very skimpy evidence, based on almost non-existent evidence. So it will come, but it takes time. It takes time to analyze blood samples. It takes time to develop vaccines. It takes time to test new drugs. It takes time to find the evidence behind public health interventions. This all takes time. And unfortunately, in the meantime, people are dying. So there's a sense of urgency, but eventually I think we'll get there.
So thank you very much. And I'll wrap up by saying it sounds from all of that we're going to be doing a lot more of these programs down the road. So with that, from Washington, D.C., I hand it back to Neil.
New York City is, for the foreseeable future, the epicenter of the virus in the United States. Its 8 million plus residents, as of this broadcast, are reporting over 300,000 positive cases of COVID-19 and over 18,000 confirmed deaths. These are statistics. Ron Claiborne, former reporter and presenter for ABC News, is a New Yorker, and the statistics become more than just numbers to him as he walks the streets of his city.
New York City is, of course, the epicenter now of the coronavirus pandemic. More than 140,000 cases just in this city, approaching 11,000 fatalities. People ask me what it is like being in New York City at this time, and I search for the right words. I've settled upon two that fit, many others do, but these two I think are appropriate: eerie and hollow.
These days, the city that never sleeps is in an induced coma. Streets once jammed with traffic, sidewalks that once flowed with pedestrians, they're now mostly empty and sad. This is my neighborhood, the Upper West Side in the 100s, and this is my street, West 105th Street. I've lived here for the past 14 years. Altogether, in 3 separate stints, I've lived in New York City for 30 years. That New York City vanished in what felt like an instant on March 16th. In the days that followed, the virus raged through this city. These days, the siren of an ambulance is the haunting soundtrack of this beleaguered city. As they pass, you think to yourself, inside those vehicles, very likely is a new victim of this modern-day plague. But perhaps to me, more unsettling than the scream of sirens is the unaccustomed quiet. This quiet in this normally bustling, noisy city is just not right. On the street, the few people who are out move more slowly now, it seems, which does make some sense. Where's there to go? Wherever it is you're going, what's the hurry? One morning I went down into my local subway station at 103rd Street. I wasn't going anywhere, I just wanted to have a look around. It was nearly deserted. It was spooky. I used to take the subway from here almost every day, and at rush hour, some trains would be so packed that you had to wait for the next one. No more. Daily ridership on the subway system, the very lifeblood of this city, is down 90%. In my neighborhood, Broadway and Amsterdam and Columbus Avenues are lined with small stores, shops, nail joints, and barber shops, discount clothing stores and delis, and plenty of storefront eateries. Almost all of them closed. And this is my neighborhood jazz club, Smoke. I love this place. It's also closed. How can these businesses survive a month with no income? 2 months? 3 months? Well, the answer is many won't. And what about the people they employ? What will happen to them? The pandemic has robbed this great city of so much of what makes it so special. The bars and clubs and restaurants, live music, sports, museums, Broadway, the jangled vibrancy and manic eccentricity of its people, that feeling you get on a Saturday evening, that feeling of possibility. And yet, with so much lost, there are glimpses of the spirit of New York and the spirit of New Yorkers. At 7 o'clock each night, Broadway singer Brian Stokes Mitchell sings out the window of his apartment on 98th Street overlooking Broadway, down to the crowd below. On the street, that small group gathers, social distancing, of course.
This is Ron Claiborne reporting for Facts, Not Fear.
Sweden has struck off in another direction pretty much from the rest of the world during this pandemic. Nearly everything is open, masks are practically unseen, and decisions have been made seemingly based on economic needs rather than those of the population's health. The jury is out on how well this is working. In a nation of just over 10 million, there have been over 21,000 cases of the coronavirus, with 2,600 deaths. Sweden's neighbours, both with populations near 5.5 million, have instituted much stricter rules and have significantly smaller death tolls, 210 for Norway and 218 for Finland. Actress Cecilia Nilsson examines the Swedish experience for us.
Hi, I'm Cecilia Nilsson, speaking to you from my balcony in the south of Stockholm, Sweden. Sweden, the country that has stuck out its chin during this pandemic. We haven't gone into a total lockdown, as many other countries have. We're still keeping our nurseries, primary schools, secondary schools, shops and restaurants open. Our chief epidemiologist, Anders Tegnell, and his expert crew at the National Health Agency have guided our government through this crisis. It hasn't been without criticism, of course. At the beginning, many wanted to see the same harsh measures as in other countries, but as the weeks go by, he's made his point, and now I think most Swedes are for it. He has been very clear from the start. Closing the schools would mean that 35,000 hospital workers would lack childcare and have to stay home to take care of the children instead of doing their much needed work in hospitals. Visiting old people's homes and institutions is strictly prohibited, and for the age group plus 70, the advice is stay home. And the word used is recommendations, a word that took some time for us to understand. It's not just friendly advice, it's the step before legislative action. Well, now everybody knows. My husband is the plus 70 age group, so he has gone out here to our summer house to spend the days here instead of the city, so as not to catch anything. I come out in the weekends to shop for groceries for him and spend some time with him, but we're very careful to keep our social distance to one another. We don't share the same bedroom, we don't share the towels, we take care of everything, so we're not really too close to each other. But it's nice anyway to have some time together. I will go back to town this evening with the bus. Nowadays you're not allowed to go into the bus in the front. You have to go by the back doors. Everybody spreads out in the bus, and late in the evening there are not that many people. So I'll do that later on. Stockholm is of course worst hit by this, with a population of 2.3 million, but the virus is spreading throughout Sweden, and we can only hope that they can learn by our mistakes and keep it from the elderly as much as possible. One thing this epidemic has put a light on is how the care for the elderly is being managed. And if it can lead to changes for the workers and for the old people, it has certainly served some purpose. Our intensive care places have been more than doubled. There's a big field hospital built outside Stockholm. It luckily hasn't come in use yet. There's still capacity in the hospitals. Of course, people are having a hard time here too. Shops are closing and businesses are closing. The unemployment rate might rise to around 10 to 13% by the end of this year. Up till now, the government has come up with several aid solutions for businesses and for private persons, such as tax reductions, possibilities to keep the workforce without firing them, easier and more unemployment money, extra money for the arts, for the regions, and much, much more. I am a freelance actor, and of course this affects me a lot. Theatres are closed. Television and film productions are being postponed or cancelled. I just lost 2 theatre jobs for the autumn and the winter. But luckily, the TV series I'm working on, Snow Angels, is still filming, and I cross my heart every day that it continues. I also do a bit of audiobook reading. Luckily, audiobooks are in demand these days. The rest of this week and the next, I will spend in a studio all by myself, or no, not all by myself, in the mesmerizing company of Isabel Allende and her latest novel. In Spanish, it is called Largo Pétalo de Mar, and it is a fabulous reading experience, a great way of spending solitary confinement. Thank God for literature. And thank you for letting me speak to you. And I do hope that when we come out of this, we'll be much wiser and better human beings. Well, that's all from me, Cecilia from Sweden. Bye-bye.
Traditions make social distancing and sheltering in place difficult, nowhere more so than in Mexico. To date, they report 20,000 cases, with a death toll approaching 2,000. But as José Cohen reports, the pandemic is progressing.
Mexico has just hit stage 3 of the coronavirus crisis, nearly 2 months after the arrival of the virus in the country. The Mexican government is now warning that the COVID-19 will soon hit with full force. The crowded capital of Mexico City is seen like never before, with little traffic and empty streets. The first case of coronavirus in Mexico was reported back on February 28th. 2 weeks later, the first death was confirmed and the government started to launch a nationwide campaign asking Mexicans to stay home as much as possible to halt the spread of the virus, but this wasn't an easy thing to do in Mexico. First of all, it took some time to the Mexican president to understand the gravity of this pandemic. As part of his populist campaign, the Mexican president has always been seen hugging and kissing people during rallies, something that he continued to do for a while at the beginning of the pandemic and gave him lots of criticism from Mexicans for mishandling the crisis. On March 31st, Mexico decided to declare a national public health emergency due to the COVID-19 pandemic, ordering the suspension of non-essential activities. Even if most of the offices and businesses are following the government's guidelines, the situation is different when it comes to gig workers. There are about 60% of Mexico's population of 126 million that live in poverty, and half of the workforce work in the informal sector as street vendors, domestic workers, etc. Many of these people are forced to work to feed their families during the lockdown and refuse to close up shops. Another weight for Mexico in its fight against COVID-19 is the high level of obesity and diabetes within the Mexican population that makes these people more vulnerable to the novel coronavirus. Mexico has not clamped down travels compared to other countries, but it has agreed with the US to temporarily close the border to non-essential travel to curb the spread of the coronavirus. Apart from impacting the economy of both countries, it has also left thousands of migrants waiting for asylum in limbo. Living outdoors with no clean water nor electricity, these migrants are more vulnerable to the coronavirus. Since the beginning of April, Mexico has been preparing a plan for the purchase of medical supplies. An air bridge has been established between Mexico and China. Tons of medical supplies have already been received, and more will come in the coming weeks. The Mexican President AMLO has also reached out to the US President Donald Trump to buy thousands of ventilators from the US. As of now, the country is set to reopen on June 1st, but some parts of the country with less numbers of cases could reopen as soon as May 18th. However, authorities will ask elders and other vulnerable people from all over the country to stay home even when the country reopens.
Today I was able to do a little interview with the municipal president of Tepoztlán, a small town with only one case, and he explains to us how he managed to curb down
the COVID-19 pandemic.
Yo creo que ha sido un tema muy difícil porque la gente no se cree. Invitar a la gente que tendría que tener una sana distancia y en algunos otros cerrar sus establecimientos. Tepoztlán es el destino turístico más importante del estado de Morelos, tiene una afluencia hasta de máximo de 50,000 visitantes. Pusimos un filtro sanitario en 3 partes, en 3 puntos entradas a Tepoztlán, y lo estamos llevando a cabo para prevenir, para detener esto un poco.
For the last 2 months, me and my family have been doing the quarantine here in Tepoztlán, Mexico, and it's been a good time to recap and to do stuff that I've been putting on hold for many years, like painting, like reading, like doing research, and spending time with my son. This is José Cohen reporting from Tepoztlán, Morelos, Mexico.
Photojournalist Cameron Neville has won awards for his stunning coverage of Australia's forest fires, risking his life to get the shots that told the stories. His documentary, Into the Fire, is outstanding. To date, Australia has escaped the worst of the virus, reporting just 6,700 cases and 93 total deaths. Being an island with a strict quarantine policy appears to have been a wise call. Still, the effect has been profound, as Cameron reports.
Hi everyone, my name's Cam Neville. I'm a former photojournalist with the Guardian Australia who worked freelance. I'm part of the Rural Fire Service here, and we attended a fire 2 days ago. We were wearing masks in the trucks, and we had one crew member whose job was to hand out hand sanitizer to people as they got in and out of the trucks. If anyone had contracted it whilst on the fire ground, we'd all have to self-quarantine. Certainly something that may be carrying on into our new fire season, which will begin in August later this year, and who knows whether we'll still be under these restrictions. Our Prime Minister Scott Morrison closed the borders to Australia back on the 19th of March. But currently everyone arriving at an international airport is forced into a 2-week lockdown in a hotel. Non-essential travel has also been banned, and the police are out in some numbers enforcing that and issuing fines to people that are just sightseeing or driving around. The sense here is that it will pass, although we haven't experienced the same kind of devastation as Italy, France, or even the UK. There are a lot of people who are very scared of what's happening. We're all experiencing much more isolation and time at home, be closer with our families. People are setting up workshops, Zoom conferencing and Skype calling. There is a sense of more connection here, which is a positive side effect. We're only allowed out to shop for food, medical appointments, exercise. You know, traditionally we do go camping, go to the beach, go surfing. We probably are coping a little bit better than some other people. We do have a lot of space, and the house is fairly well stocked with things. We've just been through 6 to 7 months of bushfires. Before that we had an 8-month drought, and straight after the bushfires, cyclone pushing through here.
For our own children, being teenagers, they have suffered. They had a lot of extracurricular activities, and that has all just come to a complete stop. So that's been hard for them socially.
It's a bit difficult. It's very hard to be away from friends because you have to stay isolated in order to keep the whole country safe, and not just like going out to the beach or to a park or to the library.
And the just change in the routine and rhythm of their days. They don't quite know what to do, and they didn't quite believe it was all real.
They are feeling a bit hemmed in, not seeing their friends, and also probably have that sense of what's my future going to be like. My work has all disappeared this year. I'm actually out gardening at the moment. I'm worried about things, and I'm thinking about things and wondering when it's all going to stop. We'll try and bring you some more news. I know not much is getting out from down here. But as I say, the general consensus is that it's been difficult for Australians overall to stay inside so much. We hope you're staying safe, and please be well. Thanks.
We have once again asked reporter John Donvan to look at where we've been since our last broadcast and where we appear to be headed in this crisis. John, once again from his home in Washington, D.C.
Hello again from
the small patch of Washington, D.C. that now comprises my territory. It's my backyard, although it's drizzling right now, so I stepped inside. Here's a 2-minute wrap of the bigger picture. And in the week just finished, the world passed 3 million confirmed cases of coronavirus infection. Roughly a third of those are here in the United States, and that puts America on top of this column that nobody wants to be part of. The U.S. has now seen more than 60,000 deaths attributed to the virus, and that's about a quarter of the global total. The next concentrations of fatality are in Europe. That's in Italy and Spain and France and the United Kingdom. China is claiming that the virus has essentially stopped killing people there, although there's a lot of skepticism about anything the Chinese government is saying. Work on vaccines continues in labs globally. People are still talking about 2021 at the earliest. A U.S. company has announced promising results on a drug that seems to make something of a difference in recovering from the disease. But those results are preliminary, and we are not talking about a cure yet, anything like it. What's been persistent in the data is the fact that here in the U.S., the virus is doing disproportionate harm in minority communities. And in general, the politics of COVID here continue to be divisive. We're seeing loud pushback against the lockdown orders in some areas, a lot of the media attention going to smallish protests, by which I mean at maximum a few hundred people who are showing up shouting the word freedom at state capitals. Some of them are brandishing weapons, assault rifles, carrying Confederate flags, and they're demanding that the government rescind the orders to distance socially. In fact, some states are now starting that. Georgia is now several days into a relaxation of social distancing rules. So there's an experiment to watch, and a lot of people are watching Georgia. And by the next time we do this program, we'll know if what Georgia did was a wise move. If the number of infections spike, we'll know that was a mistake. If they don't, that'll be a relief. And we could use some of that. Back to you, Neil.
Finally, we return to New York City. As Ron Claiborne reported, the famous Big Apple has had a transformative time during this pandemic. The effects on every part of the social and medical safety net have been significant. Former ABC News producer Marge Lipton found out just how significant last month when she had a non-virus-related medical incident, which she shares with us in the latest Day in the Life.
Hello, everyone. I'm here in the epicenter of it all, New York City. You've seen the pictures, read the statistics. Too many lost lives. Living in Manhattan, though, I have a different perspective for you on what life is like in the time of coronavirus. Namely, what happens if you need emergency services that are not virus-related. I took a fall while leaving the grocery store last week. When I couldn't get up, I knew it was bad. The store called an ambulance, and one did come in about 15 minutes. But when the paramedics saw me, they strongly discouraged me from going to the emergency room. They said I'd be lined up in the queue with all the virus patients, and it would take at least 10 hours. Didn't sound good. They suggested urgent care, which are privately run clinics that do none of the heavy lifting of hospitals, but are there for everyday medical issues. Fine, I said. The problem was, they couldn't take me there. I live on my own. None of my friends were nearby, so on a chance, I called one of my neighbors. David is a high-level martial arts practitioner and also a lawyer. I've been taking classes with him for years. He got in his car and came for me immediately. Thank you, David. At this point, I was sitting in a chair in the store, but couldn't move. He and another customer, masks on, had to carry me, wounded soldier style, to the car. At urgent care, they had a wheelchair to take me from curbside to the facility. However, there were no doctors, only physician assistants. I was seen in minutes. The X-ray technician had a hard time getting me in position, but eventually acceptable images were secured. I got a temporary diagnosis at urgent care, but I had to wait until the next day to get a final one from a real bone doctor. This was done by telemedicine, which I guess is the doctor equivalent of broadcasting from home. The good news is I don't need surgery. This is the kind of fracture that heals itself. I will be in a wheelchair for a couple of weeks and then graduate to a walker before hopefully being back on my feet. When I finally got home, some of my other neighbors could not have been more kind or compassionate. Here's Karen taking me out for some fresh air. Saul making me dinner. But it's still not easy being in my apartment, unable to have visitors to assist or amuse me. On the other hand, since nobody has much to do, helping me has become an activity for those on my floor. This does feel like karmic payback, given that just days before I fell, I was thinking how lucky I was, given all the too many people who've lost lives, lost jobs, or on long lines for the food pantry, or in any of the other truly impossible situations we're seeing. So while I'm still feeling a little guilty about my good fortune, it's something I do have the luxury of putting at the back of my mind for the next few weeks. Life will be different when we come out the other side of this. It's too soon to say how, but I am looking forward to punching again. Love to you all.
Marge Lipton, and that's it for this episode. Thank you for joining us as we hear from storytellers who the world relied upon to deliver the news and fact, not fear, for decades. It's been a privilege to be the link man between personalities, some of whom risked their very lives to bring us the news. I was deliberating what to share in my own payoff. Our UK Prime Minister elected to announce that the experts believe the peak has been reached in my country, yet daily rises worldwide make it impossible not to question the validity of throwing open doors just yet. My friends' social media feeds have started to alter their language from stay strong and stay indoors to I need a hug. Whilst there are relaxing of restrictions and beaches reopening on some shores, there are still those who wonder if this is all a little premature. I read today that a Florida lawyer has been stalking local beaches dressed as the Grim Reaper, incensed by such action. And then there are suggested cures which go from the faintly plausible to downright unusual and dangerous, and frankly have the feel of a cure your grandmother would have touted. Great-grandmother to our family had suggested avocado rubbed in your scalp can salvage a receding hairline. I'll leave it to you to decide who you should really trust for medical opinion. Most people just want life to return to normal, and that's understandable, of course. If we had ladders internally within the rooms of our house, I think our 2 children would probably be climbing the walls. Sales of alcohol are rising disturbingly here. It seems if the children are climbing the walls, their parents are climbing into bottles, but there's heartening news in that new treatments are being tried, and new vaccines are on the horizon. My faith lies in those facets and not the conspiracy theorists who see this as just another payday. And so, for my friends who just need a hug, my children who just need their friends, and our family who just want this done, we do need to remain resilient for a little while longer, it seems. And then we can see the world again, and our friends. And for me, that world won't necessarily need to be a jet trip away, because it's pretty much on my doorstep. I've just forgotten to see it each morning. I heard a wonderful quote from Proust this week. The only true voyage of discovery is not in seeking new landscapes, but in having new eyes. Stay safe until the next time.